Hi everyone, a very good evening to all of you. Thank you Sumen sir for a wonderful physiology session, and I welcome you all in this video. So quickly let me know in the chat box if I'm audible and visible, and I hope the exam really went well for all of you, and I'm sure it would be a big relief now after the exam is over. So I welcome again to all of you in this session. So it's time to relax and unwind yourself. You've worked really hard for so many months now for this exam. So it's time to relax, unwind yourself. Now the purpose of this session today is to first of all gather the questions of psychiatry which were asked in the yesterday's exam and try to get as close as possible to the question as well as options, so that it will be useful for the aspirants who are going to give the exam in the future. So let's quickly try to analyze the questions of psychiatry. So thank you to all who are telling us the questions, the options, and till now we are able to gather around 8 questions from psychiatry. If you see, I've also included the topics from which the questions were asked. A very good evening to all of you. Very happy to see you all now after the exam. So we have seen that one question from each of these topics which we'll discuss has been asked. So one question from basics, again as expected they would ask questions from basics. Also question from schizophrenia was asked, and that was related to the treatment. So we'll discuss that question. A question again from mood disorder was asked. Question again substance use, as always question from substance use was asked, and this time it was not alcohol, but again a repeatedly asked topic, that is opioid, was asked. Now 2 questions from neurotic disorder. One was trauma and stress related disorder. Again a topic which we say might not be very important, but again we have discussed this even in the LRR session about this topic. And also a question on dissociative disorder was asked. Also there was an integrated question, in fact you'll discuss this in PSM as well. So even there was a integrated question of psychiatry and PSM, and also a question from child psychiatry was asked. So these were the topics from which the questions were asked. So let's come to the first question. Let's start the session. Now please see the question carefully and on the options, and let me know if there is any correction, if there are any changes. So a person has a false belief that he has lots of property and is rich, and somebody he knows wants to kill him and take it from him. He appears depressed and physically unwell. What is seen here? So again all of you can see the question is basically related with delusion. So here they are asking you which delusion is seen. In fact this question, a similar question has been asked previously in FMG as well as even in INI-CET recently, and also some old PYQs have been asked on similar lines. So I'm sure now all of you can answer this question. Just let me know in the chat box if the options and the questions the question is correct. Is there any change? So please do let me know in the chat box. Now see this. Now the patient says that he is very rich. So we have talked about this, in fact when we have talked about in the LRR also. So we have talked about what is delusion of persecution. Person thinks, so delusion is a false fixed form idea or belief held with extraordinary conviction. So patient has a false belief. So delusion of persecution, patient thinks somebody wants to kill me. And delusion of grandiosity. What is delusion of grandiosity? Patient makes false big claims. So can you appreciate in the question here delusion of grandeur and persecution are seen, isn't it? So I hope the answer is clear to everyone. So here we can see delusion of grandeur and delusion of persecution. Now please understand, don't confuse that they have mentioned that person is depressed, so there is delusion of nihilism also. So please remember, sometimes because of these symptoms patient's mood may also be affected. So here they are mentioned that because of these the person appears depressed and physically unwell. So the answer here is delusion of grandeur and persecution. Dr. Shivani, I think there was a question related to irritability also. In fact that question we'll discuss. I think that was more related with the question on bipolar disorder. We'll come to this. Okay, so you're saying they had mentioned irritable. So for the time being I'll keep irritability also here. Right. So yes, it's a PYQ. Very good. Now let's see the next question. Let's see the okay, so you mentioned that depressed and physically unwell, it is not mentioned. Okay, so I'll remove this. Right, thank you. So please keep on adding any updates, any changes, so that we can, when we finally post the video in the app of these PYQs, so that we can get an exact question, right? So next question is, a 28-year-old software engineer visits a psychiatry clinic as he is suffering from sleep disturbances, low mood and stress in his current job from the past 3 months. So patient has some stress related thing at work, and because of this he is having sleep disturbances, low mood, he is appearing stressed, he cannot work properly and having difficulty to balance the family and work. So there is some form of impairment also mentioned. So there is a stressor, they have mentioned some stressor at work, stress at work, and he has no prior psychiatric history. What is the likely diagnosis? Now tell me, I'm sure now you can answer this question. In fact, we discussed this even in the LRR session as well. So can you tell me the answer? The options are adjustment disorder, generalized anxiety disorder, acute stress disorder, or is it PTSD? Now can you appreciate, in acute stress disorder and PTSD, we have discussed that the difference is in the duration, and the level of stressor also usually is a major life-threatening event, and we have discussed the symptoms with the mnemonic MAHI. So we have ruled out C and D. Now in generalized anxiety disorder also we have discussed that there will be excessive worries. Patient has excessive worries, very important. Patient is worried about small things. So here the answer is very good. The answer is adjustment disorder. In fact, we have discussed this again. So I am again taking references from what we have discussed in the LRR as well, also in the main videos we have talked about this. So stressor or the trauma can be divided. We have divided into severe or mild to moderate routine stressor. For example, there are changes, developmental changes are there. For example, a child, he has finished his school and now started going to college, maybe shifted from his home to the hostel. So sometimes such changes, such routine stressors can also cause certain illnesses. So here it is adjustment disorder. Patient has behavioral emotional symptoms, and we have discussed that we will exclude other disorders. If nothing is getting, then we will make a diagnosis of adjustment disorder. Usually we see that symptoms occur within 3 months of the stressor. So symptoms would start within 3 months of that stressor. For example, there is loss of job or there is some medical illness. So the stressor would start, or the symptom would start within 3 months and usually resolve. Very important, see this, symptoms would resolve within 6 months of resolution of stressor. So as we resolve the stressor within 6 months, you will see the symptom would also resolve. So that is again telling me, giving me hint that it is related to the stressor. Yes, so it is adjustment disorder. In fact, a very similar example we have discussed in the main videos also. In the version X, we have discussed this example in which a 24-year-old male lost his job for 1 month and he presents with low mood, irritability, decreased sleep. So in fact, a very similar question we have discussed even in the main video. So the answer here is adjustment disorder, and usually the treatment would be, the treatment is therapy. So treatment is therapy such as CBT. If the person comes in crisis, crisis intervention can also be done. I hope this is clear to everyone. Done with this question. So the answer here is adjustment disorder. Right, let's now go to the next question. See this question, again a very interesting question. Please see the question and let me know if the question and the options are correct. A man came with a bizarre presentation to the hospital. Now there is a collateral person, some collateral person gave a history of recent earthquake few months back. So they have given you a history of some stressor. They have given you a history of a stressor. The person neither remembers personal information nor why he came to the hospital, that is 100 kilometers away from his home. What is the likely diagnosis? Now please see the question. Let me know if the question and the options are correct. The options are dissociative amnesia, dissociative identity disorder, schizophrenia, global amnesia. So first look at the question and the option. Very good, yes. In fact, it is dissociative amnesia. Now can you appreciate, in fact we have discussed when we talked about dissociative disorder in the main video as well, that usually after a stressor, they have mentioned a stressor, there is dissociation of memory from other functions, So here the person is having amnesia to certain personal information, but also can you appreciate there is also a component of fugue. So patient lives somewhere far and he is presented to another place. So there is also a component of fugue. But the answer again according to the options is dissociative amnesia. Okay, so they had mentioned family members. Okay, so I'll put in the question, family members were there. Okay, great. Right. I hope this is clear. Fugue was also there. So can you appreciate? Yes, fugue, yes. So fugue is basically where we'll discuss both. So let's first talk about dissociative amnesia, inability to recall important personal information, usually of traumatic event, and usually it is inconsistent with the ordinary forgetting. So person may forget certain things which were of traumatic nature. For example, the person was kidnapped, let us say, for 2 days, and when the police rescued that person, he does not have any memory of what happened during those 2 days. So again, you can understand the stress was probably so much that the mind, used dissociation to decrease the stress. So this is dissociative amnesia. Now let's understand what is dissociative fugue. See, fugue means to wander. Here there is unexpected sudden travel away from home or workplace. So the person may travel unexpectedly, the travel may be very far. And there may also be amnesia to past event, and person may assume a new identity. But very important, person maintains basic self-care during the fugue state. So it is only certain areas which are getting affected. In fact, a very similar question we have discussed in the main video, that there was a person, Mr. D, financial loss was there and he went missing for 6 months. 6 months later, somebody found him in another state and he does not have any recollection of the past. He has in fact a new identity. This is dissociative fugue. So I hope it is clear what is dissociative amnesia and what is dissociative fugue. In fact, please see this. Now DSM-5 as well as ICD-11, they don't consider dissociative fugue as a separate diagnosis, but it is added as a specifier of dissociative amnesia. Now if in the question only dissociative amnesia was there, then that would be an answer. If you're saying dissociative amnesia and dissociative fugue was there, so again, although it's a specifier, but since they've mentioned dissociative fugue, it will be a better answer, because can you appreciate in the question they've also mentioned that there is, again, the person has gone to a very far off place. So there is also a component of fugue. I hope this is clear, right? So I'm seeing the, okay, maybe temporary word was there. Yes, it may be. Yes, it usually is temporary. Very good. Just tell me the option. Was fugue also mentioned? So just let me know, was fugue also present in the options, yes or no? Just let me know, so that the answer then would change. If fugue was also there, you can go with fugue as well, right? I hope this is clear, right? Fugue was there, so yes, there is a component of fugue there. Okay, I'll add dissociative fugue. So I'll add dissociative fugue was there, right? So don't worry. So again, I'm telling you, sometimes the recalls may be different. Don't worry. I'm telling you that if dissociative amnesia is only there, then that will be the answer. If fugue was mentioned, then that would be a better answer, because they've also mentioned the component of fugue, right? I hope it is clear to everyone. Let's see the next question now. Again, slight trickiness is there in this question as well. I want all of you, please tell the language of this question. A 30-year-old female is very talkative, she is hyperactive, doesn't sleep well and spends a lot of money for shopping for past 2 weeks. So they have also mentioned the duration as 2 weeks. When asked question, she becomes irritable and angry. So they have also mentioned the mood. The mood is dysphoric here. The mood is dysphoric here. So again, you are thinking in terms of mania, hypomania, isn't it? Now tell me, some students said, sir, there was a component of delusion of grandiosity. Had they mentioned something like this, that the patient thinks he is very rich, or something related with delusion of grandiosity, was that mentioned in the question? Okay, right. Right. So don't worry. So this is just to get the question, so that the future aspirants, they are able to get a better recall of the question. I'm sure you must be tired, but let's just try to see the question. No grandiosity component was there. So now can you see, it seems patient may be having mania or hypomania. Now again, in the option they have given both. They have given bipolar 1 disorder with manic episode, bipolar 2 disorder with hypomania. Now we have discussed what is mania, what is hypomania. So duration for mania we have discussed at least 1 week, and for hypomania we have discussed duration is at least 4 days. And we have also discussed the symptoms of mania with the mnemonic me, dig, fast. Right. Now again, in this question we have discussed that how to differentiate mania from hypomania. Again, in hypomania, the symptoms are similar, but they are not severe enough. So the impairment is not very severe. Also, there is no psychotic symptom, usually no need of hospitalization, and usually flight of ideas if given, you will prefer mania. So again, if they have not mentioned anything to differentiate, so what to go with? So tell me what you have marked in this question. What they have, so this is the question they have given. So can you tell me what you have marked? Is this the exact question, or was there something mentioned which would help us differentiate whether it was mania or hypomania? So can anybody tell me? Both seems to be correct, from the question which I have got. If this is the exact question, you can say, sir, both appears to be same, but still you can still go with, if this is the exact question, I will still can consider it to be a manic episode. Maybe the person has come for, visit to the psychiatrist, maybe he's brought to the psychiatrist, so maybe the functioning may be more impaired. But again, you are correct if you say that, sir, both seems to be the right answer. But just let me know, was there anything mentioned that would differentiate mania from hypomania, so that we are able to get the exact question. So this was the exact question. Thank you, Dr. Sikha, you are saying it's the exact question. So then you can go with bipolar 1 disorder. We know in bipolar 1 disorder means if there is an episode of mania, we call it bipolar 1 disorder. Bipolar 2 is patient has depression and hypomanic episodes. I hope this is clear to everyone. Even in the image based session also we have talked about how to make the diagnosis. So again, can you appreciate such questions they are asking again and again? So we have discussed this question in the image based session as well. Okay. That question we have discussed, Dr. S, we have discussed that question. Yes. Now let's come to the next question. Now this is a question which I will say again and again they have asked. It's a PYQ. Now let me know if you have answered this question correctly. A patient is brought to the emergency department with signs of opioid poisoning. So patient may have respiratory depression, there may be meiosis, patient may be even comatose. What is the treatment of choice? So tell me what is the answer of this question. This question we have discussed in LRR also, even in image based session also we have discussed. Very good. The answer is naloxone. Very good. Yes, so I think it's a repeated PYQ which has been asked. So similar question in fact we have discussed in the previous session of LRR, even in the image based session. So the answer is in opioid intoxication poisoning, the answer is we'll give IV naloxone, which is a opioid antagonist, short acting antagonist. Very good. So I hope this question is clear to everyone. So sometime when we see such question, it's a big relief seeing such direct questions in the exam. Now let's see the next question. Now this is again a question, I would say we have got different versions. So just let me know if this is the question and also if there is any modification in the options. A patient with schizophrenia, so they have mentioned that patient has come to us with schizophrenia, developed muscular dystonia. So there is EPS, developed muscular dystonia, EPS he has developed and was treated for it. So we have discussed that what is the treatment of acute dystonia, they give anticholinergic agents, and patient now presents with complaint of dry mouth, dizziness, hypotension. What is the most likely drug causing these effects? So just tell me if this is the exact question. The options are benztropine, risperidone, haloperidol. So these are antipsychotic, option B and C, and D propranolol. So see the question and just let me know if the question is correct. Also see the options, there may be some variation, so don't worry, just let me know if there was any modification in the question. So as we have discussed, it seems to be a case of EPS acute dystonia, and you must have given anticholinergic agent such as benztropine, and that would have caused these side effects. I hope this is clear to everyone. Okay, physostigmine was also given in the option, but that we will not use in the management, isn't it? Right. Okay, so I'll change the options. Yes, so we will modify the options, don't worry. So physostigmine was there in the option. So propranolol was not there in the option, so we'll cut propranolol. Now do the options appear similar? Some said maybe clozapine was also given. Let me know if that was given in the question. Few students said, sir, clozapine was mentioned in the option. So again, antipsychotic is mentioned. So the options are these, and I hope the answer is clear to everyone. For acute dystonia, we must have given patient anticholinergic agent such as benztropine. We may give promethazine as well. So the answer here is benztropine. I hope this is clear to everyone. Just let me know in the chat box. I'll just wait. So that this question, because I got different modifications, so that when we are uploading in the main video we can put as close as possible to the question which was asked in the exam. So just let me know. Also after this video, in this video itself, in the comment section, you can still, if you come across any or you remember any changes, please mention those changes so that we can incorporate them in the main video. I hope this is clear. So we have discussed this. We have talked about this mnemonic DP at night. We have talked about important EPS. So remember acute dystonia, sudden contraction of muscle, such as patient may have torticollis, there may be oculogyric crisis, and treatment is anticholinergic agent such as benztropine. In fact, this is again a PYQ, but they have asked it in a different manner. So they've tried to modify this, and maybe a psychiatry and pharmacology integrated question they've asked this time. Right, thoda mushkil. Okay, no problems. If you remember, you can just put the options, the questions, any changes in the comment section later on as well. I hope this is clear to everyone. Right, so let's move on to the next question. Now see this question. A 6-year-old child presents with bedwetting Which of the following is the treatment of choice? Please see the question and also the options. Two options which we could get was behavior therapy, CBT. Some students also said that even drugs were also mentioned, desmopressin, imipramine. So it's a case of, usually we know that the control over bladder is achieved by 5 years. So anybody who is not able to achieve the control 6 years and above, we call it as enuresis. Okay, enuresis, isn't it? And what is the treatment of choice? So remember this, we have discussed this in the main videos as well. For bedwetting or sleep enuresis, the behavioral techniques such as bell and pad or bed alarms, that's the treatment of choice. So if in the question they have not mentioned bed, bell and pad or bed alarm, so the answer will be behavior therapy. So behavior therapy is usually the first option. We can also use various other techniques, but remember, if they ask you the treatment of choice, then it will be behavior therapy. Of course, if they ask you drug of choice, that would be, if they would have asked drug of choice, then what would you have marked? Can anybody tell me what would you have marked if they have asked drug of choice? Suppose they asked drug of choice, then what would be the answer? What would be the answer of drug of choice? Then it would be desmopressin, right? Even imipramine is also, having anticholinergic property. It's a TCA that can also be used. Oxybutynin, that can also be used. So remember, if they ask you treatment of choice, it will be very good. It will be behavior therapy. Right, so students said that they have put behavior therapy in the question and not specifically they have mentioned bell and pad or bed alarm, so that will be the answer. Okay, question is first line of treatment. Thank you. Yes, so first line of treatment, again first line of treatment, we'll start with again non-pharmacological approaches, and behavior therapy again would be the first line treatment. I hope this is clear to everyone. Right, now let's come to this question. Again, this is more of an integrated question, PSM psychiatry integrated question. But again, I always discuss few things, rule out the options, try to see the name and you can answer. So see this question, a very interesting question. A girl came with history of schizophrenia to a PHC. Which of the following is the tele-mental health program provided by Government of India to deliver mental health care services via telephone and online application? Nowadays a lot of things are becoming digitalized. So even in when we talk about the healthcare sector, especially even in the mental health care, now there is digitalization. So what is the answer? Even if you don't know this, just try to rule out the options. Like, what is UWIN? It's a digital platform for vaccination. So always try to rule out. What is NEET? It is for basically a software to report and track leprosy cases. Leprosy cases. Option D, it is for TB. So what is the answer? Yes, Tele-Manas. Again, you can see, Manas, it is from the word man. So man is mind. So yes, it is Tele-Manas. So let me just, briefly discuss this since it was asked. So it is basically in the National Tele-Mental Health Program, Tele-Manas is included. That is Tele, M for mental health, A for assistance and networking across the states. It was launched on the World Mental Health Day in 2022, 10th of October by Government of India under the Ministry of Health and Family Welfare. So basically it has a toll-free number, so person can call, and also there is a mobile app as well. So this is Tele-Manas. I'll just discuss. It is basically a two-tier system. So anybody who is facing mental challenges, they can connect via call, they can connect, and subsequently in the first tier system there will be state Tele-Manas cells, so which can which includes counselors, and if required even mental health specialists are there, and if it need to be further treatment is required, it can further be referred in the tier 2 in-person services. So person can go and visit medical college or different programs, or can also use this app. So you can also remember another name, e-Sanjeevani app. Through this audio video consultation can be given. So this is about Tele-Manas. Yes, it's a new thing, remember. So just remember, always, I say whenever even such new question come, especially in psychiatry, try to see the options, try to see the name. Many times just by looking at the options and looking at the names, you are able to get to the right answer. I hope this is clear to everyone. I hope this is clear to everyone, right? So these were the questions which we could get. So just let me know if there was any other question. Just let me know. These were the questions which we could get, and I hope the exam went well. So this was about the psychiatry session. Just let me know if there were any newer questions you could remember, or if you find any new question later on, you can just put the question in the chat box in this video so that we can answer. Okay. No, we didn't discuss. Yes, it is more of a psychiatry and PSM question. Yes, but still I have taken this question so that you have an idea. I hope this is clear. Right. So again, thank you so much. And again, this is the time which you can utilize, and you have sacrificed so much. So this is the time in which you can do all the pending things, maybe spending time with your near and dear ones, or maybe if you missed out of any of your favorite series on Netflix, Amazon, you can watch them, or maybe go on that trip which you have been thinking for a long time. So utilize this time. And again, thank you so much. Keep smiling, keep moving forward. Thank you so much.